Okay, Glenn, got that ready for you.
Great, thanks, Frank.
Got the Spiriva ready.
All right.
How you been going with that?
All right, I think, but like I've just been telling the doctor, I still think I'm coughing too much.
Sure. And did the doctor say anything about how to carry on with the COPD? Any advice or anything like that?
Really, just keep on keeping on. Really was the main advice. Nothing glaringly different.
Right. Okay.
Yeah.
Well, how long have you been treating your COPD for?
Oh, it'd be a year now.
Yeah.
Frank.
And how long have the doctor had you on the Spiriva for?
Oh, pretty much the same. Yeah.
Okay. Well, with the Spiriva, what we want to see is that it's helping to control your COPD symptoms more.
Yep.
That it's slowing the progression down.
Yes.
But that we're seeing less of the phlegm and coughing and shortness of breath.
Yeah.
Okay.
Yeah.
It's a progressive disease.
Yeah.
So unfortunately, it is going to get worse.
Yeah.
And there is no cure.
Yep.
But there are things that we can do with along with the Spiriva that can help with that progression.
Good.
Okay.
Good.
Now, it's important because of that to make sure that you're using the device correctly.
Yeah.
So I might just get you to show me. I've got a device here that you can
Okay.
show me on.
Yeah.
How do you use it at home?
All right. Well, what I normally do is.
Okay, Glenn, that was really good. You're using the device correctly.
Oh, good.
You're giving yourself the best chance to treat the condition.
Yep.
A lot of people don't use the devices the right way.
Yep.
Medication doesn't get deep into the lungs for that reason.
Good.
So they're not giving themselves the best chance to really treat those symptoms.
Yeah.
Okay.
Yeah. Good.
Talking about your symptoms, you talked about coughing earlier.
Yep.
Any other symptoms at all, like shortness of breath, maybe some phlegm or mucus?
Yeah, certainly. I feel like I get shortness of breath, especially when I'm sort of out and about and I've got to walk up a bit of a hill, or if I've got an appointment in a building and I've got to go up some steps. I definitely short, but no, not the other things.
Thank you.
Okay. Well, how would it be if we could get you more mobile and get you able to handle those hills and stairs a bit better?
Yeah, that'd be great. I feel like it's a real. I almost feel like an invalid. Okay, so that'd be great.
Well, the Spiriva is definitely the right medication for your condition.
Yeah.
But how are you going with using the Ventolin to help with symptomatic relief?
I think I've been a bit naughty there, Frank. I know that when the doctor first started me on this, wanted me to use Ventolin as well. I've got to be honest, I haven't really been using it.
Oh, okay, all right. Well, the Spiriva is really important for preventing your symptoms.
Yeah.
But the Ventolin's really important for helping relieve symptoms on a day-to-day basis. Kind of, for really quick relief.
Yep.
So Ventolin is a bronchodilator.
Yes.
So it opens up your airways.
Yes.
And it works quite quickly within 5 minutes.
Yep.
So it's really good for that symptomatic relief.
Yeah.
And you can also use it if you're expecting to be walking up hills or upstairs.
Oh,
As well. So you can
Okay.
use it just before you're expecting to do
Oh,
some
right.
sort of exercise.
Right.
Okay. It's been a while, so how about we go through using the Ventolin
probably a
for you,
good
so
idea.
make sure you're using that correctly. That was really good. You're using that correctly.
Oh, good.
We've had Diane out a couple of little things, but overall, it's looking good.
Yep.
Moving forward, I think you're giving yourself the best chance to treat those symptoms successfully.
I will.
Okay. Now, we'll go back to Spiriva there.
Yep.
Just want to make sure you're not suffering from any side effects.
Oh, yeah.
Can you tell me if you've been experiencing any dry mouth, constipation, perhaps a stuffy, runny nose, some muscle pain, maybe a blood nose?
Certainly stuffy nose and dry mouth, definitely. The other ones, no, I don't remember getting any of that. Sure. I just thought that was like just part of the COPD, not the Spiriva.
Yeah, it's a fair assumption, but I think probably more due to the medication there.
Oh, okay.
Can you tell me how it's impacting you day to day?
Well, yeah. It's another thing that just, as well as the disease, just makes me feel like a cripple.
Right, yeah.
An invalid, I can't get out. With my stuffy nose, I feel like I don't have the energy to get out and about.
Mm-hmm.
And then with the dry mouth, I'm sort of sipping water all day, and then I'm forever looking for a loo.
Yeah.
So again, just another thing that makes me feel like I'm immobile.
Sure, that's understandable. How about we look at some things that can help you alleviate those symptoms and get you kind of free to be out and about a bit more?
Yeah, fantastic. That would be great.
Now, the Biotine mouth spray.
Oh yeah.
That's a medication that helps to activate your mouth's own production of saliva.
Okay.
It's in a spray bottle, so it's convenient to use. You can carry it with you throughout the day.
Yeah.
But also, just use it as you're experiencing symptoms throughout the day. That'll help alleviate the dry mouth and stop you from sipping water all day.
Yeah.
I think it's a good thing that you're drinking lots of water,
Uh-huh.
so don't necessarily cut that out, but hopefully we can remove the burden of that.
Yeah, right, okay.
Now, as far as your stuffy nose is concerned, there are a few different things that we can look at to treat those symptoms.
Yeah.
But I think the Nasonex spray will be a good one to take on.
Okay.
It's what we call a steroid or a cortisone spray.
Yes.
And that has a build-up effect in reducing the inflammation in your nose.
Okay.
So we use that one every day as a preventative to help prevent those symptoms.
Yeah.
Okay?
Yeah.
Just one spray into each nostril once a day.
Okay.
You can do that in the morning, first thing when you get up.
Yep.
And again, make sure that you're using it every day.
Yeah.
And I think perhaps with this one, just watch out for a blood nose.
Okay.
That's one of the common side effects of it. If you do experience that, stop using it and we can look at something else.
Yeah. All right.
So that one there is going to be really good at helping drying up the nose and making it less stuffy.
Yeah.
So you're not blowing your nose all the time.
Yeah.
Feeling quite.
Yeah, that'd be good. Yeah.
All right.
Well, yeah. No, that would definitely help.
Okay.
Yeah.
Okay, great, Glenn. Now I'm conscious of your time. I won't keep you much longer, but just another quick minute. I want to cover your COPD management.
Yes.
Are you looking at anything to help prevent your COPD symptoms and the progression?
Well, I quit smoking. It was the doc who sort of got me onto the quit smoking. That was also about a year ago.
Right.
So I've been pretty good with that. Well, pretty much off the fags now.
Mm-hmm.
But apart from that, not really. Is there
Just
other stuff?
Yeah, absolutely. We can look at a couple of different things. I mean, definitely the smoking is really good.
Yeah.
Congratulations on that. That's going to really help a lot.
Yeah.
The number one thing that we want to make sure that you're doing is not smoking.
Yeah.
But I think also, making sure that you're keeping an active and healthy lifestyle.
Yeah.
A bit of exercise and balanced diet.
Yes.
I think you can talk to your doctor about an exercise program that's right for you.
Yep.
That can really help your body be fit and healthy to make sure you're dealing with the condition as best as possible.
Yeah, okay.
But also apart from that, you can be a bit preemptive with things and making sure you're not out when the air quality is particularly bad. So keep an eye on newspapers, TV reports, radio weather reports, and even online.
Okay.
And that can give you a heads up of days that you're probably best to avoid being outside if you can.
Right. Okay. I hadn't thought of that.
Yeah, just to help make sure that you're not putting undue pressure on your lungs.
Yeah.
Okay.
All right.
And I think the other thing is also making sure that you're up to date with your immunisation. So flu shot and pneumococcal shots are important.
So with the flu, I've been a bit hit and miss. Some years I do get a jab,
Sure.
some I don't. The other one I haven't heard of.
Okay, yeah, right. Well, I think based on that, it's important that we get you in to get the flu shot.
Yeah.
It's really important that you're getting those flu shots every year.
Yeah.
Because catching the flu, you're a high-risk person.
Yeah.
So, and if you do catch the flu, it can get quite severe quite quickly.
Yes. Yes.
And then become really serious with your lungs.
Yeah.
Particularly symptoms like shortness of breath.
Yeah.
They can be exacerbated quite a bit.
Okay. Yeah.
Okay, so we want to avoid that. And making sure that you're up to date with the flu shot will enable you to fight off the flu for every year, because every year is a different strain.
Yeah.
Okay. The pneumococcal vaccine, I think you can talk to your doctor about whether it's appropriate. Okay. So yeah, I think we can book you in for a flu shot right now.
Okay. Good. That'd be great.
Before we do that though,
Yep.
just one last thing. Make sure next time you're in with your doctor, talk to your doctor about a COPD action plan.
All right.
It's going to give you guidelines of what to do when you've got exacerbations and things like that, and infections. So it'll allow you to handle your condition more independently.
Yeah.
And make sure that you're really dealing with things as they come up as best as possible and as quickly as possible.
Yeah. Okay.
Okay. And I'll print up some information for you.
Yeah.
So you can take that and read it.
Yeah. Well, I reckon you've given me an action plan today, Frank. That's really great. The way you sort of flushed a bunch of that stuff out. That's great.
Happy to help, Glenn.
Yeah. All right. Terrific. Thanks, Frank. Great.